Hi dear listeners, you are welcome again for our presentations. Today we are talking about coronavirus, the threat to the globe today. Let's address these 5 questions so that we can understand what is this condition, coronavirus. What is the mode of transmission of this virus? How do you know that one has a coronavirus? And what are the complications and the consequences of this coronavirus? How is the coronavirus treated and how is it prevented? The first question, what is coronavirus? Like all other viruses, coronavirus is a microorganism, very small, tiny. It cannot reproduce by itself. It must have a host cell where it can multiply, a living cell. A virus can direct the cell machinery to produce more viruses. For the virus to multiply, it needs to hijack the system of working of the host cell. Then it take advantage of that host cell, then it multiplies. Most viruses will be having what we call RNA or DNA as their genetic material. This is RNA in center, inside, like greenish color. It would be having another material called reverse transcriptors. This chemical, it will use it to transform itself so that it is accommodated in the host cell. I mean the cell of the organ that has infected. So coronavirus gets its name from a distinctive corona. So it has a corona, which is like a crown of sugar protein. Let's say envelope. An envelope that surrounds it. That is very distinctive compared to other viruses. It is known to have the longest genome of RNA-based virus. And one single strand of nucleic acid is made approximately by 26,000 to 32,000 base long. So those are the characteristics compared to other viruses. It was first described in 1960s. That's the time it was described. So there are main 4 known genesis, if you may call them species, in the family of coronavirus. Which one are they? It's alpha, beta, gamma, and delta coronavirus. The first 2, alpha and beta, they only infect mammals like bats, pigs, cats, human beings. Those are the beings that breastfeed. Okay? So gamma coronavirus, the third one, it does infect birds such as chickens. While this 4th one, delta, can infect both birds and mammals. Coronaviruses are a family of viruses known to contain strains that cause potentially deadly diseases in mammals and birds. Some of them, notable strains, there is a current one that was given a name of 2019 nCoV. It's a one coronavirus, the one in China. There is another one called Severe Acute Respiratory Syndrome, SARS, and Middle East Respiratory Syndrome, MERS. All of them, they cause deaths in human beings. So, if you take these examples that were given just right now, the MERS-CoV was first reported in Saudi Arabia in 2012, while SARS-CoV was first recognized in China in 2002. So, on the 31st December 2019, World Health Organization in China, in the country's office, it was informed about the cases of pneumonia of unknown cause, which were detected in one city, Hubei province in China. And this pneumonia was very severe that they could not understand what behavior is this condition that's not responding to treatment. Then they started investigations. They worked very hard. Then on the 7th January, just 1 week after, the causative pathogen, the organism that was responsible for this severe pneumonia was identified to be novel coronavirus. So, when you check the map, how it started and where it was located, the main bigger cycle, it was here in China. You can see the high concentration was in China, but it started now jumping to other areas. It reached Japan, it went to Canada, or United States of America, Australia, and United Arab Emirates, and as well as in Europe. That time, we are talking about 31st January 2020, Africa was still spared. If you compare this virus, 2019 nCoV, and you compare it with other viruses, you can see some differences, like this Marburg, which was in 1967, it had infected 466 people in 11 countries, and it killed 80% of all the people that it had infected. And when you check another one which killed, which killed many people, the high proportion, what you call fatality rate, when you check this one which killed 77% was in Nepal. But though it had only affected 2 countries. And when you check now H1N1, it infected many people in many countries, 214, and it killed 284,500 people. Though when you check the proportion, the fatality rate compared to the other ones, it had killed 0.02%. Now the current one, the 2019 nCoV 2020, it has already, by the time it was reported on the 31st January 2020, it had affected 24 countries. But today, as we speak, on the same date of today, it has already affected 29 countries, and the fatality rate is around 3% today. How is the coronavirus transmitted? Coronavirus is believed to have a reservoir as a bat. The bat, this bird, it's a mammal. It's a bird that is not a bird, but it does fly, and it is a mammal. It breastfeeds. So it is believed that it is remaining there in the hibernating state. And it is believed also that it is transmitted from animals to human beings. The vector would be what? The pangolin. However, it was discovered that it was mainly seen the time it was discovered in Hawaii City. There was a close link with the seafood and the poultry and wildlife market in that city. So investigations were still going on, and even now they're still going on. Today, as we speak, 78,950 cases are reported. It has already caused 2,463 deaths, 29 countries affected, and 1 African country. According to World Health Organization now, we are told that the incubation period is between 2 to 10 days. Some literature talk about 14 days. So the researchers are going on, epidemiologists, virologists, the scientists are seated, they are concentrated, they are looking for means to prevent, to treat. They are not seated down. So although we are told that this condition was from this Hawaii city, the condition remains to be a zoonotic. That means it is animal origin. The evidence now suggests that the main transmission, though it can come from animals, but the one which is the high-speed transmission mode is human to human. How does it happen? If a person has the coronavirus and coughs in the proximity of a non-infected person, the small drops will be hanging in the air. As you breathe them in, then you get infected. You might also get it for a person who just sneezing, then you catch them. Alternatively, if these droplets go and go on a table or anything that, or a handle of the door, then another person comes and touches them. The time you touch your eyes, you touch your mouth, then you are taking in the viruses. You can see the person who is infected is having the coronaviruses in the respiratory system, whether he's talking, coughing, sneezing. The next person who is not infected now is going to be infected by breathing them in. So it goes like that as a mode of transmission. How do you know that one has a coronavirus? Apart from history, one tells you that I was traveling, I was in a country where there is a high concentration of incidences of corona. Then, in addition to that, a person comes with fever, coughing, shortness of breath, breathing difficulties. Then you can still start suspecting coronavirus infection. In more severe cases, it would cause pneumonitis, inflammation. The alveoli get infected. The severe acute respiratory syndrome, kidney failure, and eventually, once the kidney is failing and the lungs are failing, other organs as well will fail. Then it will lead to what we call multiple organ failure. There are also other specific tests, virologic tests, which will help on confirmation whether it is coronavirus or not. If you do chest x-ray of a patient who is having coronavirus, you will see that there is a difference between the two, the normal chest and abnormal chest. This is a chest of a female. You can see the breast and the lungs very clear. Where the air is on the x-ray, it will be black. Same way on this middle chest x-ray, but on the corona infected chest, you can see everywhere it is white. This is edema. Edema, it's an inflammation going on in the chest. Everything is swollen inside. There is no way to get oxygen. That will be causing a lot of damages in terms of respiration. The kidneys, we talk about renal failure. The kidneys will shut down because they get infected, affected, then it will even reach other organs, then causes multiple organ failure. Most fatalities reported were elderly people, persons with pre-existing co-morbidities, meaning people who have low immune system. When you talk about low immune system, we are talking about low soldiers of the body. The soldiers are not enough to fight infections, meaning anyone who is in a frail condition, and once the virus comes in, it will cause more fatality compared to somebody who is immune competent. The consequences of coronavirus. The severe cases will cause a very severe infection on pneumonitis and a severe acute respiratory syndrome. The respiration will be a very laboring one. Kidney failure, multiple organ failure, these are the severe cases with the complication on the physical part. However, we spoke about the lungs, which will be full of what? Inflammation and what? And water. Then it will suffocate the person. Death might come. That's the biggest complication that we are experiencing with coronavirus on the physical body. It has killed many people. On an epidemiological aspect, on a social aspect, it has killed many people so far. You can see the infection rate is very high already. 78,000 is too high and is still going on. And the people who have died already, there are many countries and still going on. We can never neglect the negative impact when it comes to the social life. There is a lot of emotional stress in families and countries. Some people are in quarantine. Quarantine means you are isolated. You are not in contact with outside. It's like a prison. But there is no other way, because that's how we need to control the condition. There is a very serious international economical burden. The traveling have stopped. Businesses have stopped between continents, between countries. That's a very serious problem. And it is spread in 29 countries and still going on. We don't know where it is reaching. If you can see this chart, you can see from the time it started, it is represented with these very short bars on this chart. These short bars, it is telling us that it was linked to Taiwan market in China. But when you observe these longer bars on this chart, it is said that there is no link to Taiwan market, which means the more problems are observed far from the origin of the place. So we need to wake up. This is a very serious, it's a concern. How is coronavirus treated and prevented? The treatment is supportive. There is no specific therapy that is known to go and focus on the virus and kill it at this moment. However, World Health Organization, with researchers, epidemiologists, virologists, and other experienced people in these epidemic conditions, they are working very hard, really very hard, to fight this condition and to find a vaccine, and work as well on the means of minimizing the transmission. They have won before. We have got many vaccines to many diseases. We believe that they are going to win again. We need to support them. Many people are working hard on giving treatment, supporting patients, but also they need to protect themselves. They need to protect themselves. Basic principles to reduce the general risk of infection: we need to avoid close contact with people suffering from the acute respiratory infections. Frequent hand washing. We need to wash hands again and again and again, especially after direct contact with ill people or the environment. The ethanol that we know, alcohol, it is believed that it can reduce infection by 70% in 60 seconds. So disinfecting hands, sanitizing, it's very important. When sneezing or coughing, you are advised to cover the mouth, either with arm or a tissue that we throw away. You don't cover the mouth with the hand, because the hand will be passing to another person as you are greeting the person. In case of symptoms suggesting of respiratory illnesses, before, during, or after travel, it is very important now to seek medical attention and share the travel history with the healthcare providers. Now, for people who are preparing food, in order to practice safe food safety, whether you are chopping meat, it is advised to wash your hands between handling raw and cooked food. And again, if animals die and no one knows, animals that are dead or sick, they are not to be consumed. And even in places where there is outbreak and there is meat and they feel they need to eat it, if they decide, it should be cooked thoroughly. The researchers have shown that they can cook them and cook them well. We need to remember that infection goes quicker when it enters the mucosa. The mucosa, eyes, mouth, and nose. We need to avoid touching eyes, nose, and mouth. We avoid contact with sick animals. We avoid with stray animals with their waste products and fluids, especially in the markets. We need to wash hands And in the workplace, disinfectant is very, very important. If this condition was going to remain in that one area, yes, it would have attacked many people in a very short period. We were going to call it an epidemic. If it was going to remain in one area for longer period, it was going to be called an endemic. But now, since it has spread to more than one country, they have crossed countries' borders, went to other countries, even it had reached continents. It is a pandemic. This is a worldwide problem. If it was going to be like one case here, another case there, another case in China, another case in Australia, another one in Canada, without a close link, that was going to be called a sporadic cases. But now we are dealing with a pandemic issue. Please, let's come together. Let's work together. Let's listen to our leaders. Let's follow the directions. Let us listen to health professionals, and let us apply the safety measures so that we can overcome this threat of this 2020 period. Thank you so much. Welcome you to come and visit African Emotion, and for more topics you can find some on our website, or you can send an email. We thank you so much.